Okay, I'm just going to finish up. I'm Catherine, the Pain and Oncology Services Manager in Rehabilitation. An exercise physiologist by background, so I'm thrilled by what we've been hearing tonight, and I've got my step count on, and I did take the stairs up to here, or as far as I could come. I've only just got a very short presentation just to bring you up to speed with what we've been doing with our rehabilitation program, because people are curious that we've only just ticked over 12 months, and we did start our pilot program this month last year, and we've certainly got some graduates in the room amongst us, and it's wonderful to see them healthy and sharing new stories tonight. It's been thrilling actually to see them again. So this is just going to be very quick to bring you up to speed. So I'll just skip over the survivorship planning, but really this is a concept that's come about from Trish and her association with Jane and her peers, and really the concepts of our program are really around point 3 and 4, the latent effects and the looking at the physical and the psychological consequences of what happens after your diagnosis. Realistically, our survival rate is increasing, so therefore that's wonderful news, obviously, but there's more and more people that are potentially needing help and support, and we've touched on that tonight. And realistically, a lot of our patients have impairments that are not just physical as a result of surgery. There's cognitive issues around concentration, emotional issues in regards to relationships, self-esteem, body image, all those sorts of things. Nutritional, we've just talked about just with vitamin D, just the plethora of information out there and how complex it is for us as physicians and health practitioners to sort through and navigate. For our patients who come in, it's mind-blowing, and many, as you know, Google and use Dr. Google and so on. So it's very complex trying to work out how much and how often and what should I do. And these are intelligent people and curious people in our population who are asking that information of us. Whoops. Just since we started last year, we've provided over 1,300 sessions to our patients, and I think that's been a real commendation from our clinical team. Obviously, we've done a lot more than the same time this last year, and there was a period just recently where this last quarter's dropped off a little bit because one of our doctors was away, and we just went, oh, hang on a minute, we need to make sure that doesn't stop our service going forward. So we're working on that, we've fixed that scenario now. But we've provided predominantly what was started as a group program has really, and I can probably say this with our ladies in the room, that when we first started, I would say to the patients, use us. Come and see us and use us, because this therapy is free to them. Go out into the community and see a psychologist, you pay your gap fee, or your exercise physiologist. When you come into rehabilitation and you've got your cover, all of this is free, so use us. But I was amazed at how many patients outside of the group program didn't necessarily come and take up the psychology options or the nutritional options and those sorts of things. And so we've changed our model so that we have our group program, our standard program, and now all our patients see our dietitian one-on-one and they see our psychologist one-on-one. And that at least starts that relationship and fosters that if it's required with our patients. And I think one of the interesting things that a lot of our patients have shared is the fact that, I'll come back to that, we've had a real mixture of patients coming in. When we first started looking at the program, we wanted to know who is our patient group that really needs rehabilitation, and I think anyone who's inquired, we've seen them. So we've had patients who have had double mastectomies and no chemotherapy or radiotherapy, and we've had the combination of the others. And so all of our patients have got very different needs, but we're able to, with our screening assessment and our distress thermometers and those sorts of things, do what Bridie's alluded to tonight and really navigate and work out what the issue is for this person in order to facilitate their recovery. We've had some patients come in and do one-on-one psychology before they come into the group program, just so that they feel comfortable and settled and their anxiety is more under control, if you like, or their angst. Their questions have been answered a little bit in regards to before they come into a group program, and perhaps their needs are not really necessarily going to be met. They're not usually our typical rehabilitation patients. And I mean that in the sense that there's still a misconception that rehabilitation is for your older patient who's had a stroke or a hip replacement or a cardiac episode or the like. One of our current patients was told they're probably too good for our program, and she wants to do the program a second time. She's really engaged in it and really used us, which has been fabulous. So I think there's still a misconception that rehabilitation is not for patients who come in off the street and have gone home and don't need inpatient therapy, that We have a full spectrum of allied health clinicians, and we work as a team, and we'll palm you off to someone else if we think we can't help you, but there's someone else within our building and in our team that can do that. And of course all our patients are eligible for, they need rehabilitation funding, but the foundation has been able to support a couple of patients who have come through, which has been marvellous recently. We've had 75 referrals to date. In the first 6 months, primarily all those referrals came from 3 practitioners, and most of those are in the room. Thank you. And thank you from our patients' point of view. But in the second 6 months, 50% have come from those 3. So our patients are becoming curious. They're seeking us out, but also there's more and more people who've done GP presentations and the like, and more people are starting to refer to us, which is marvellous. There are 2 patients in our current program, who finished on Tuesday, who were recommended by peers to come. And to me, that's the biggest plus. That's the biggest acknowledgement that we're doing the right thing, that we're on the right path, that our patients are saying, this is worth dabbling in. And everyone will get something different out of it. It's not necessarily for everyone. And the other bit of feedback some patients have said is they didn't know what they needed until they came. So they didn't know they needed a social work to actually talk to them or help them about finances or their relationship with their partner or an OT who was looking at fatigue until they've come into the program, because they've never had to deal with that before or seek that professional out. So our referrals are easy and they're on the website. What our patients tell us, our feedback this week, is it's holistic, the staff are wonderful, and they are. But I think the biggest thing is that most patients are just lacking in confidence. We've had patients come in who haven't really felt confident about how to use their arm after surgery, and they've just protected it, even though there's no restrictions. Or when it comes to exercise, they don't know how much and how often, and we hear that often, all the time. And they just really need that confidence to be able to step out there, go into local gyms, and they've usually done it with peers, and I know a few of the people in the room tonight have stayed in contact, which is marvellous. The primary thing they've picked up is really about exercise, emphasising their own health and prioritising things, and deal with the issues that have just been dwelling in their lives that they just sort of haven't sort of been pushing aside, and now as a result of this scenario in their life, they're just going, it's time to address it. So eating well, those sorts of things are all common sense that we've talked about. Jane just touched on the Epworth fundraising that's now occurring. The Japan walk that we've got sorted for next year, there's 2 of them and they're all sold out, which is fabulous. And that has meant that, people are donating into our oncology areas to help us become better clinicians, but also allow our patients to have an experience to go and do something as a result of feeling fantastic and ready to do something new. But also the funds are helping us as a service develop. And so now that we're continuing and going on, it's time to look at what our brand is and how we can be recognised so more people can find us, and we're ready to update our material and those sorts of things, which have been little flyers and bits and pieces to this point in time. So we need a more professional look. So what's next? This is the last slide for the evening. We're about to start a program in Hawthorn next month. A few of our staff are here, and we're currently training them. They're coming across to Camberwell, and a lot of them have got oncology experience already, which is just a big plus. I've already touched on the brand and who we are. We did a research exercise, if you like, with our first pilot program about whether or not this is useful and beneficial, and the feedback and the outcomes demonstrated it's worth continuing, hence why we're here today. But also, we've been changing the model and changing the program based on our patient feedback. Our poor patients get sort of feedback fatigue by the end of the program. But it's time to draw the line in the sand and actually start getting data to say this is worthwhile. As a result of the success of this model, we'd like to start next year looking at other tumour groups, particularly prostate and so on. We have a lot of patients coming through here at Epworth and our 4 sites who could potentially be coming through. And we've just got a scholarship to be able to go to America and the UK next week, particularly looking at the survivorship training rehabilitation programs they have that are accredited in America. So that's kind of where we're at the moment. We've been steadily, quietly plodding along, and we've just kind of started to boom and grow, which is just marvellous. We didn't want to get too far ahead of ourselves and not do it properly, but I think we've now got it something that we're very happy with, and our patients are happy with, and we'll continue to develop and move on that. So that's sort of where we're at the moment, and it can only get better from here. So I'd like to sort of finish on the evening and particularly thank Bridie and Jane and Richard for their time and their expertise tonight. It's been marvellous to sit and listen. So if there's anyone who would like any questions, we certainly have opened the floor to you. So fire away. Anyone?
Is that referral open to GPs everywhere, not just patients?
Absolutely, absolutely, yes. Mm-hmm. Anyone else?
I just wanted to take the opportunity to congratulate both Trish and Catherine on really being behind all of this, and I mean all the other rehab staff here, but particularly those two have been really the driving forces. And I mean, I think particularly to getting people to view it in the same way as cardiac rehabilitation, that it's not just for people who've got a problem or something, it's just part of the normal process of going through it. And I mean, I don't know, I don't want to put any of you guys on the spot, but whether any of the people who'd been through the program had anything to add. Mignon, you're not short of a word normally.
It certainly, it was on my last slide, was to thank the faith of the first pilot program, because they didn't know and we didn't know, and we were very, very nervous, and I know they picked up on our nervousness when we first started the program, and so they've been particularly special in trusting us when we tried something new, and so thank you for coming along tonight, and they've certainly continued to give Trish feedback when she catches up with them and so on.
Yeah, I'd like to say, I did the second program, and for me it was really getting a roadmap for life. You sort of go through this cancer thing, and then there's empty space, and then there's life you have to deal with, and it sort of filled in the blanks in between, apart from great friendships. Yeah, it kind of really helped put everything into livable thinking, I guess, and I stopped crying. It's quite the off the hat. There's no reason to stop crying. Yeah, great information. Yeah, so thank you for putting on it, Trish.
Cheers, Faye.
Yeah.
Thank you. Excellent. Alrighty, we might finish there. Thanks.